Hello. Many people experience significant anxiety when visiting the dentist, often due to fear of pain, needles, or the overall dental environment. Now, this anxiety can lead to avoidance of necessary dental care, which can result in more severe dental issues over time. For nervous patients, sedation can be highly beneficial if behavioural techniques have proven to be unsuccessful. Now, one method of anxiety relief involves the use of benzodiazepines, which work by enhancing the calming effects of a neurotransmitter called GABA. In this video, we will explore how GABA naturally reduces anxiety in the brain, how benzodiazepines amplify this effect, and where in the body they exert their anxiety-relieving action. Welcome, I'm Dr. Steve Parker, and this is Dental Chat. So what's happening with our anxious patient? In an anxious patient, the brain experiences heightened activity, particularly in regions associated with fear and emotional regulation. The amygdala, a key structure within the limbic system, plays a central role in processing emotions such as fear and anxiety. When an individual is anxious, the amygdala becomes overactive, triggering an exaggerated response. This heightened activity in the amygdala sends signals to other parts of the brain, such as the hypothalamus and prefrontal cortex, amplifying the feeling of anxiety and creating a state of hypervigilance. Well, if only there was some way to calm the brain. Well, of course there is. The topic for today's video, benzodiazepines. Now, to get an understanding of how benzodiazepines work, we need to go back to some basics. We need to look at the nerve membrane. We also have the extracellular area and the intracellular area, inside and outside the nerve. And of course, the membrane is a bilipid cell membrane, so it's a fatty membrane. Now, inside and outside, there are an enormous number of different ions and proteins and various things. So we're just going to pop some on there now. And you can see that there's a combination of sodium and chloride and potassium. But the thing to note here is that, and there's many more than this, of course, other ions as well, calcium and various things. But if you were to add up all the positive and negative charges, extracellular, and compare them to the intracellular ions, you would find that it is actually negative inside, about minus 70 millivolts. And this is known as its resting potential. So in a nerve at rest, it is negative inside the nerve compared to outside. Now, it's important to remember that ions, charged particles, can't pass through the fatty membrane, the bilipid cell membrane. Okay, so now we've removed all the other ions and just left the sodium ions here. As before, we've got our bilipid membrane. It's minus 70 millivolts inside the nerve, and that's reflected in this graph over here, which shows voltage along the y-axis and time along the x-axis. And you can see that at rest, it's minus 70 millivolts. It's negative inside here compared to outside. Now we know that the ions can't pass through the fatty membrane. And so what they need to pass through is a sodium channel. Okay, and currently the sodium channel is blocked. Now let's imagine someone has a finger and we get a needle and just lightly touch it. They can feel it, but it's not causing any pain. So we're going to be looking at the nociceptors here, the activation of nociceptors, the pain receptors. And it's not causing pain at this stage, and that's because it didn't reach the threshold. There wasn't enough stimulation to cause the inside of the nerve cell to reach the threshold, and so you have a failed initiation. However, let's look at it again, this time with the needle pushing quite hard into the finger. Now we can register pain, and the reason is that we have reached the threshold. And once the threshold's reached, all of the sodium channels will open. So you'll see this open here, and now sodium ions can enter. And because they're positive ions, as they enter, it's going to become less negative. It's going to move from minus 70 millivolts to minus 55 millivolts, which was reflected over here, which means that we now have an action potential. And you can see this here. We have depolarization. So we now can feel the pain because of the action potential. So now we're going to look at just the chloride ions, negative ions. And you'll see again we have the bilipid membrane. But we also have this other different channel. It's the GABA chloride channel. And from its name, you can tell that it allows chloride ions to pass through, but it's currently closed at this point in time. There is a majority of chloride ions outside the nerve compared to inside. Now, upon the GABA chloride channel, there's a couple of receptors. One is the GABA receptor, the other is the benzodiazepine receptor. And we'll now have a look at exactly what GABA is and what it does. So, what is GABA? Well, it actually stands for gamma-aminobutyric acid. It is, in fact, the primary inhibitory neurotransmitter in the central nervous system. It reduces the neuronal excitability by binding to GABA receptors on neurons. It's often referred to as the body's natural tranquilizer, and it helps to reduce feelings of anxiety and stress. So GABA is a naturally produced inhibitory neurotransmitter that we all have. So now if we go back to looking at the nerve membrane, you'll see that we've got the chloride ions, we have the membrane, and we've got the GABA chloride channel. We've got the GABA receptor here and the benzodiazepine receptor here. So now, if your body wants to inhibit firing of this nerve, it will release GABA. And you can see GABA is going to be represented by the little blue triangle. So let's get some GABA down there. So what happens if your body wants to inhibit this nerve? It will release this GABA, and the GABA will find its way to the receptor. Once it's done that, it will open the channel and allow chloride ions to go through. And we have a few go through. Now, chloride's negative, of course. So as negative ions enter, the resting state here will become more negative inside, which means that it will drop down. And so it now becomes harder to reach the threshold to actually cause an action potential. So that's why it inhibits the firing of nerves, because it makes it more negative inside. But what about our benzodiazepines? Well, they're going to be represented by the little green boxes here. So your patients come in, they've taken some benzodiazepines an hour before the procedure, and they've now worked their way to the nerve. So you can see them here. Now, here's the benzodiazepine receptor. What's going to happen is that move over to the receptor, and it now allows a lot more chloride ions to pass through. What it does is it increases the effect of your naturally produced GABA, which means it becomes even more negative inside, which means on the graph here, this will drop down even further. And so now it is a lot harder to reach the threshold to fire off the actual nerves. So now if we have a stimulus, it will fail. Now if we even increase the stimulus more, it will still fail and won't actually fire off. So to sum this up, by amplifying GABA's inhibitory effect, benzodiazepines significantly enhance the calming and anti-anxiety effects of GABA. In dental patients, this helps to reduce the anxiety and fear associated with dental procedures, making the experience more manageable and less stressful. It's important to remember that benzodiazepines work on all excitable tissues in the body, not just neurons in the brain. And so excitable tissues, including the heart, muscles, and other areas of the nervous system, can also be affected. Well, I certainly hope that helps explain exactly how benzodiazepines work to produce a more relaxed patient. Don't forget to subscribe and like so we can continue to produce these videos, and we look forward to having you join us next time. Thanks so much.